Good evening and welcome to Money Matters. My name's Charlie Huntington and I am the Public Relations Chairperson for Life Sciences PA. Life Sciences PA is the voice of advancement for the biotech, life science, pharma, and medical device industries within the state of Pennsylvania. Tonight, we are pleased to continue our special series on science leaders in our local communities. But before we get started, I want to remind our viewers that financial issues relating to life science, healthcare, or technology matters or companies may be discussed on the show. These discussions are not and should not be viewed as financial advice. Moreover, since this program is pre-recorded and shown at a later date, please keep in mind that this information may no longer be current. You should always check with your financial advisor before entering into any financial transaction. I'm pleased to have with me tonight as my co-host Kimon Hatza. Kimon is a business attorney and partner at GrowthCounsel LLC in Philadelphia. His focus is in the life sciences, healthcare, and information technology areas. Welcome, Kimon.
Thanks, Charlie.
Kimon, I wonder if you would bring our viewers up to speed with what's been happening with you and with GrowthCounsel since our last meeting together.
Sure, happy to do it. Well, the last quarter of every year for Business Transactions Council is really busy, so this is our busy time, and we're a little bit crazed, but it's a good thing. In terms of work that we've been doing, we have a couple of new clients that came on board in the life sciences area. One is a medical device company with a very good product that's already being used by surgeons in the region. The others are in the information technology or wellness space, which is a space that I've seen a lot of activity in over the last couple of years. So we are doing largely for the companies in those areas that are early stage. We've been doing principally debt and equity financing for them. And for the more advanced companies, we've been acting like outside general counsel, basically. They're companies that are active and operating, but aren't big enough yet for their own in-house legal staff, and we've kind of been general counsel to them from the outside.
Good for you.
Thank you.
Well, we've got a busy show tonight. Before we get going, I would like to explain to our viewers how you can have your question answered on a future show.
You can have your questions answered on Money Matters. Please go to our website, money-matterstv.com. On our homepage, click on the banner on the right that says, Send us your questions. While you're on our website, you can find information about our host and guests, as well as show notes and links about this show and past shows. Money Matters is also available as a podcast on iTunes and Stitcher, so you can listen to Money Matters while you're on the go. That website address, again, is money, M-O-N-E-Y, -matters, M-A-T-T-E-R-S, TV.com.
It's with great pleasure that I introduce our special guest for tonight, Gerald Makoid. Jerry is president and CEO of AIROS Medical, headquartered in Audubon, Pennsylvania. They're a medical device technology manufacturer and designer specializing in compression therapy devices that treat lymphatic and vascular disorders. Jerry started AIROS in 2016 and has 25 years of corporate startup experience across multiple industries. From 1999 to 2002, Jerry served as vice president of sales at Data Center Direct, an IT startup that was eventually acquired. He also previously served as regional sales manager with StoreNet, another IT startup that he helped grow to $120 million in annual revenue. In 2015, he joined the Villanova University Mentorship Program that counsels student athletes and provides internship opportunities. He's a graduate of Ursinus with degrees in business and economics. And at home, he is married to Joy and is the father of two sons, Jerry and James. Jerry, welcome to the show.
Charlie, thank you very much for having me.
Sure. How did you get into this business?
It's a good question. When I graduated from Ursinus, the economy was kind of really dormant at that time as far as getting jobs. So I was very lucky to be introduced to an entrepreneur at StoreNet, and it was a startup company. And I really cut my teeth to learning business, a startup business from that ground level. And we grew it, like you mentioned, to about 120 million. But when I left there, I started a couple different companies. But I was introduced to this product back in 2002.
Okay.
And I really liked the profit margins at that time. And I started a DME company called Remarks Medical Services. It still operates today.
Okay. And since we're a financial talk show, help define DME for our viewers.
Not a problem. DME it stands for Durable Medical Equipment Provider. And what a DME does, if you were at a doctor's office and if there's any mechanical device that the physician would like to prescribe for you, they send that script to a DME. And that Durable Medical Equipment Provider will go out to the home, educate the patient on the device, and handle all the billing. So it's a separate company. Unlike the pharmacy where you would just go up and get a pharmaceutical drug, DME is handled differently within the medical community.
They come out.
They come out to the home. They make sure the product is fit properly. They educate the patient on its use. And like I said, they handle all the billing from Medicare to secondary to primary insurances.
Okay. So AIROS Medical, tell us about AIROS and tell us about its technology.
Sure. Well, I been and still run Remarks Medical Services, and the longer I got involved in it, the more I realized I needed to touch the manufacturing aspect of it.
Okay.
And not being familiar with it, the manufacturing piece of the equation, I contracted with a company in King of Prussia, and they did it for me for about 5 years. They ran into some financial issues, and I realized at that point I needed to just do it myself. And like you mentioned earlier on, about 3 years ago, I bit the bullet and jumped off the cliff and just decided to become a manufacturer.
Good for you.
Yeah.
So how would patients use your devices?
Like you mentioned earlier, our device handles what's called lymphedema as well as chronic venous disorder. Lymphedema primarily is for breast cancer patients.
Okay.
They'll develop swelling in the arm. 20% of all breast cancer patients will develop lymphedema.
And how far after treatment how far after an operation? This is after an operation,
Well,
correct?
lymphedema occurs when you get your lymph nodes either removed or radiated. So
Okay.
yeah, so a physician will know relatively quickly whether you're going to develop lymphedema. There'll be a swelling that will start within the arm.
Okay.
And some women it'll increase 1 to 2 times the size of their other extremity. So
Okay.
and if left untreated, there's some serious infections that can occur. So as quickly as we can move that fluid out, the better off the patient is.
Okay.
So getting back to answering your question, our device just goes over that extremity, and it acts as a massage. It will really work its way up from the lower part of the arm and just remove that fluid, get it past the damaged lymph nodes and back into the system.
Okay. So you mentioned lymphedema, and what was the other one?
Chronic venous insufficiency. It's as we age, as we get older, our heart's drawing blood up from the lower parts of our legs. So the less activity that we have, the more that fluid ends up pooling at the bottom parts of our legs. You'll see a discoloration in the legs. You'll see a swelling in the leg. And just like we do for the upper extremity, we're doing that for the lower extremity. So we're moving fluid and we're moving blood flow from the lower parts of the leg. So we'll shrink the shrink the edema, the swelling, and a lot of those patients will develop chronic ulcers, and we help with that healing process as well.
And it helps with circulation. Right?
Absolutely. That's the number one on both. The lymphatic system is part of the circulatory system, so we're helping both upper and lower extremity as far as that circulation.
So how did you come to innovate and manufacture for many of your competitors, right? Most people would say, I can, just to dumb this down for somebody like me, you can, if you're going to sell to a big box retailer, you better not sell on Amazon as well, right?
Absolutely.
I mean, how does your industry lend itself to do this, and how have you created this unique marketing opportunity for yourself?
Well, when I jumped into it, I realized as I could not do it as Remarks Medical Services, my DME company,
Okay.
because I compete with all these other players in the same level. So I realized I needed to start another company, and
Okay.
I was very fortunate to have 3 startup partners who are they're got great backgrounds as far as the industry is concerned. We realized we needed to start that separate entity, and because our intent was to sell to my competitors. Now, most of my competitors know that already, but we really embraced the technology. We knew what the DME needed on the bottom end is a very cost-competitive product with great technology, and that's what we provided them. So they don't mind buying from me at that point, to answer your question.
And I think you mentioned that geographically speaking, you guys aren't right on top of each other, right? This
No,
is more of a, it's not, cottage industry is the wrong word, or the wrong phrase, but it's there's not one huge player, correct?
Absolutely, not right now.
Okay.
There's 3 million women in America are diagnosed with breast cancer. Chronic venous insufficiency, diabetic foot, that's another level of market. So there's not enough DME players that specialize in this that can cover the entire United States. Right now, we currently have 50 DMEs that we sell to, and we want to grow that to about 75, 100 by within the next 2 years.
Would that give you one in every state at that point?
Yes, that's our goal, is to have 1 to 2 main players in each state. Now,
Okay.
of course, like the Idaho's, if we can get 1, I'll be happy. But
Okay.
California, I'll probably need 10 DMEs to cover the state of California. But
So-
that is the goal.
Right now, across the country, just from a patient standpoint, there's going to be different levels of care depending on where you live, right?
Absolutely. There's not enough DMEs to educate not only the patients but also the physicians. Lymphedema, a woman who's away from her oncologist goes to her family practitioner may not be well versed in lymphedema. So it's very difficult to get down to some patients and educate them on what they're actually going through. So it's difficult for a DME to educate the physician too. It's tough to get in front of them. I mean, it's a very, very busy area, and lymphedema is not a prevalent disease, so to educate them gets harder and harder for us.
Thanks, Jerry.
Jerry, does your company have proprietary intellectual property?
We would like to. I would love to say our product has lockdown IP that I can move it into the marketplace and say, hey, this is really our value. And unfortunately, I don't want to say we're a Me Too product. But we've enhanced a Me Too product to the point where it has a tremendous amount of value to the marketplace. And our goal as a company is just to grow the amount of products that we have out there, and to get the medical community educated as far as what we're doing.
Okay. What are the treatment options that are available in your space now for what the types of things that you're trying to help treat?
I would say the gold standard of care is what's called manual lymph drainage. It's when a physical therapist would come into the home and actually it's a massage process. It's very lengthy. It's very costly, and it's very hard to do. And there's not a tremendous amount of physical therapists that are trained in it, but they'll actually massage the hand and work their way up the arm to remove that fluid. That's the gold standard. Very expensive. It has to be done every day. Lymphedema is a chronic condition, so no matter how much fluid we move out, it's going to return the following day. So that is the gold standard. We like to say we're an adjunctive therapy to the PT practice. So we come into the home. Our device, a patient would use it for 30 minutes, an hour a day. We'll remove that fluid, make it more manageable for them, and then they can go about their day and then use it again the following day.
Do they need a PT, or they can use this themselves?
We sell directly to PTs and educate them on what we do,
Okay.
and a lot of them embrace it because they realize they only get paid a certain number of visits to a patient, and afterwards the patient goes home and they teach a self-massage.
They don't do it though.
Doesn't do it. Compliance is very low on self-massage, and they don't do it well. These PTs go through a tremendous amount of training to do it right, and to do a self-training session with a patient and expect them to do it right, it's asking a lot.
You're talking about from a health insurance standpoint, they'll only pay for so many, visits or whatever from the physical therapist, and then that's it.
Yes.
For the PT. Okay. Earlier, Charlie and you were talking a little bit about driving innovation to the low end. Can you tell our viewers a little bit about what that means, and then what you've been doing to help innovate that?
Sure. Being a DME gives me great insight as far as what my other customers are dealing with on a day-to-day basis. And we really innovate on that with that in mind. What I realized early on is the products that are in our space have just been sitting dormant from a technology standpoint for a number of years. Some simple things like a timer or a vacuum to remove the air from the appliance was never done in the past. So our goal was to really get this thing where it's manageable and easy for the patient. So when we innovate with the patient in mind of how can I have he or she use the device at least once a day. And it's an important thing. It's ease of use, it's quiet. When our DMEs go out to the home, they'll set the patient up, right in front of their TV. They can watch their sitcom, put on their sleeve. The sleeve would operate for an hour. It's very, very quiet. It's not going to disturb them. And so when we innovate, it's make sure it's quiet. Sleeves are easy to put on and off. Ease of use is really the big equation in all of this.
Talking about, again, driving innovation to the low end. A lot of companies, say DME type companies, not necessarily your product, they might have a lower end product and a higher end product, and they really want to sell the higher end product. So there's a disparity between what the lower end, the more affordable product can do and what the higher end product does.
Thanks for bringing me back to that, Kim, because it's really important. A lot of our competitors, from a manufacturing standpoint, manufacture at the very high end. There's two devices in our space that get paid for, and it's a low-end device and a high-end device, and it's like that with most medical equipment. And most manufacturers manufacture for the higher-end device. It's a bigger return. But when you talked about insurance earlier, it's harder and harder for our patients to afford, especially with large co-pays, large deductibles, to afford the higher end device. So when we manufacture, we do have a very good high end device, but we drive that technology down to our lower end product as well. It's advantageous for not only our DMEs to compete with some of the bigger players in this space, but it's very advantageous for our patients. They're not stuck with a $800 or $1,000 deductible for a $5,000 unit. We drive them down to a lower end device where maybe it's more of like a $20 or $50 copay or a $100 deductible for the device. So it's good for the DME and it's also good for the patient, which is the most important thing.
Sure.
And whether it's high end or low end, do either of these does a higher end one have to take place in the practitioner's office, or it can happen at the patient's home as well?
Everything is really, I mentioned DME earlier, and it's called HME. It's home medical. So all these devices are within the home.
Okay.
We can set up in the patient's, within the doctor's office.
But it's
We've done
not
that.
necessary.
We've done on numerous occasions. When we do that, it's usually the nurse or the physician wants to learn about the product, and we would love to do it on a patient. So that's a great scenario to have. We would love it. It kills two birds with one stone. I get to educate a patient and educate the physician at the same time. But it is a home use product, and then we really leave it up to the patient to make sure they use it every day.
What innovations do you have on the horizon for 2020 and in the near term?
We really want to, and it's a good segue from the previous question, we really want to allow the physician and the nurse to understand how often our patients using the device. They're going basically on trust when the patient is coming in. And patient could say, hey, I'm using it, 2 hours a day, 9 days a week. it's not the case usually. So some of the innovation we're doing now, we're making it cloud enabled, where the usage data gets moved to the cloud. And then we let the DME, who's taking care of that patient, pull that usage data and give it to the physician. So it's now in the physician chart. So when he or she comes in for their next visit, there'll be a calendar of when did they use it, what pressures did they use it at, how often, how many days a week, how many times a day. And that data, I think it's not only critical for that the patient knows it's being recorded, because it gives them it has them take a step back and say, look, I know this thing's being pushed out. The data's out there. I need to start using it more and more, because when they go in to see the physician, they're going to know.
Also, I think, and I'm just saying this because I have a medical device that I use, and insurance won't pay for it if they know that you're not using it and they track that usage. So I'm assuming that helps support the continued payment by the insurance company of the patient's need and use of the equipment.
That was our initial conversation with it in mind, because we realized that's probably where the Medicare and the insurance companies are going to be going. They started out with high usage devices first. Ours isn't a really high usage device. I mean, it's not a big population, but it'll get there, and we'll be ready for it. So we'll be the first company. Hopefully, we'll have it out second quarter of next year. We have it 90% set within our software, so we'll be ready for it. But that's definitely what we're preparing for.
I know when we had lunch together, you mentioned that you're manufacturing your product in China to your specifications. And with all the trade issues that have been going on between the U.S. and China, I was wondering whether you've been adversely impacted by that.
We have not to date, but we are scheduled to be on the next tariff, which concerns us. But we manufacture. We've been manufacturing with that in mind for the last 6 months. We're prepared for it. I'm not adverse to it, to be honest with you. I work with China quite a bit. I've got a great manufacturer in Dongguan, and also another one in Shanghai. They're prepared for it. They're ready for it. So it does make it difficult when we get into the pricing models, and do we push this down to the DME? And that could be difficult because their margins are very, very tight. We have to keep that in mind. The expenditure of a DME to get a script, verify it with the insurance companies, drive out to a patient's home, and it could be a 10-minute drive or it could be an hour-and-a-half drive. To drive out to the home, there's a lot of expense involved. They have to take care of that field rep that went out there to set up and educate the patient. So do I push it down to the DME, that cost increase, or do I absorb it, or do I work with my partners over in China and say, hey, let's figure this out between the two of us? And that's where our discussions right now.
Okay, thank you.
How are you presently funded?
Everything was, we did it as a startup, in essence. I leveraged Remarks Medical, which had 15 years of financials behind it, which helped us a great deal. So I wasn't your typical, bootstrap startup.
You were already in the industry.
We are in the industry. We already had customers,
yeah.
and a lot of startups can say that. So day one, once we had a product over here, we had 20 customers waiting for it, and coming off of our dock. So the funding, I really leveraged the Remarks Medical financials at that point, but you always, when we did the business plan, I had it for a year and a half. It took us 2 years, 2.5. I had our expectation as X amount of dollars. It was 2X. So I thought we could do it entirely with the Remarks, the financials, but we had to go to outside sources as well.
Any additional tips for entrepreneurs who are going to try it with regard to funding, Jerry?
Yeah, you really have to sit down when you're doing your planning, and most entrepreneurs are optimistic, right? Everyone
100%,
is. You don't start a business unless you're optimistic. don't be optimistic with your planning, because you're gonna fall a little short. There's some things that are gonna pop up that you weren't expecting, financially, as well as if you're moving a product through the FDA channel. There's going to be some issues there as well. So keep that in mind when you're doing your forecasting.
It's a great tip. So what does success look like for you and for AIROS, say, over the next 5 years?
We have short term. I would say we have a 5 and a 10-year plan. Any entrepreneur will tell you that you want to do an exit strategy at the end of all this. You're not working all these hours and investing all this capital with no return on the back end. So we do have our 5-year plan is really to get our revenue numbers to where we want them, which is probably, I would say, 4x from where they are today.
Okay.
And the 10-year plan is to really align ourselves with an outside manufacturer that would like to take us out at a later date, but it would have to be right, and that's the most important. That's the hardest thing in as far as an exit's concerned.
Okay. All right. And we're getting close in terms of time. What would you say would happen if the next presidential administration went to a single pay healthcare system?
One of the reasons why we wanted to get into manufacturing was to be closer to that price point. It would be very difficult for our product to survive a single payer layout. We would be ours is not a critical care product, it's a quality of life product. My vision or my thought process would be that would be one of the devices that would be eliminated, because the single payer is such a large expenditure. And
Right.
there's going to have to be some cuts. Our product wouldn't probably be under that cut. So what do we do as a manufacturer? We have to manufacture at a very aggressive price point to then at that point sell directly to the patient. So that's what our thinking is if we go to a single payer.
That's where you are. Well, we have enough here to have another show. You've been a great guest, Jerry. Kimon, I want to thank you for joining me as co-host today.
My pleasure, Charlie.
Our guest next time is going to be Rija Beres. She is a vice president of CBRE, and she's going to be discussing commercial real estate. Thank you for joining us, and we'll see you next time.